A lot has gone on in the world and in New Mexico in the last 2 weeks, so let's take a look and see what's going on with COVID-19. It helps to put the United States in perspective with the rest of the world. We have 23,000 new COVID-19 cases per day in the United States. One way to think about that is that we are putting 23,000 new cases per day into the world. In fact, the only country that is putting more cases per day into the world is Brazil. And why do I say into the world? Well, people don't stay in their own country. People move around. We are an interconnected world. Everyone who gets COVID-19 in the world could potentially interact with anyone else. If we look at the rest of North America, while we produce 23,000 per day, Mexico produces about 4,000 per day, and Canada 395 per day. But what about relative burden? That looks at the experience of an individual country. It's simply the number of new cases divided by their population, expressed as per 100,000. Brazil is experiencing the highest relative burden with 1,240 new cases per 100,000 people per day, and you can see the rate of rise. We are often compared to the United Kingdom. We produce 23,000 new cases per day compared to the United Kingdom, producing 1,300 per day. When we look at the relative burden by dividing the cases by the population, we can see the United States has something like a 30 times greater burden on a population basis. What about a country that has done well? New Zealand has done remarkably well, and this has been for several reasons. They have taken a very aggressive approach. They have enforced their restrictions. They have a relatively small population, but most importantly, they are literally an island and could seal off their borders, which they did. As a result, for the better part of a month, they had no new cases at all. But then something happened. The most frequent visitors to New Zealand come from the United States, United Kingdom, Singapore, China, and Australia. Collectively, these countries produce 40,000 or so new COVID cases per day. It was inevitable that this happened, and a couple of people from the United Kingdom went to New Zealand and created new cases. You know the expression, no man is an island? Well, it turns out even an island isn't an island. We'll come back to this concept shortly as it applies to New Mexico. This is the average for the United States in terms of number of cases per 100,000. Here's New Mexico, and you can see we're better than some and worse than others. If we look at our neighbors, this is a denominated rate. Our relative burden is higher than that now of Colorado in terms of cases per day. However, Texas, Utah, Arizona are seeing substantial rises in their number of cases per day. What about absolute numbers? Texas and Arizona together have about 4,000 new cases per day, and you can see the rate of rise. Arizona is approaching full capacity of many of its hospitals. And while the Texas governor is not alarmed, I think it's fair to say that many Texans are probably alarmed by these graphs. Okay, that's Arizona and Texas. Why would that matter to New Mexico? Remember, No island is an island, and certainly no state is an island. Travel between Texas and Arizona goes on all the time. People in Tucson and Phoenix get out of Phoenix for the summer. People in El Paso interact with Doña Ana County constantly. And think of long-haul truckers. They'll stop and have a meal or maybe spend the night in Texas, maybe in Arizona, and certainly they're going to stop along I-40 and I-25 in New Mexico. This is a logarithmic scale. On a logarithmic scale, exponential growth is represented as a straight line. The dotted line represents the rate of growth we were experiencing before public health measures were put into place. We're over 10,000 cases total and over 450 deaths. Another important part of this is to see that the deaths and the cases parallel each other. They're just offset by about 2 weeks. Remember, infection fatality rate is what we wish we could find, but we don't know infected people. All we know are people who were tested and therefore are called cases. So for people that have been tested and proven by their tests to have COVID-19, the fatality rate is about 4.5%. By comparison, the national average is about 5.6 to 5.8%, and seasonal flu is about 0.1%. Imagine those cases that are done, they're closed, they're over. Well, those people either have recovered or they died. Of those people, the good news is 91% have recovered. An important trend is cases per day over a 7-day average. You can see that mid-June there was a substantial spike in cases. It then came back down. But let's take a look at that spike a little more closely. It turns out most of those cases occurred in people who were incarcerated. Now that's of course very important because those are people in an enclosed space who are at extremely high risk of getting infected. But from an epidemiologic point of view, those are also people who cannot interact with the general population. So it is worthwhile to remove those numbers from our overall calculation. When we take out the incarcerated population, the cases per day look very different. How does this relate to key events? We can look at the relaxation of restrictions, the first time it happened. Then there were the large gatherings related to the protests over the murder of George Floyd and other issues. The important thing about those from a biologic point of view is that it was a lot of people getting very close together, but they were in an outdoor environment and many, not all, but many wore masks. And so it became a natural experiment. This was followed by the second level of restrictions being relaxed. And when we were looking at this back in around June 10th, we were worried the rates were going to rise, but as you can see, it eventually came back down. Now there's been the third wave of restrictions relaxations, and it's too early to know. Over the next couple of weeks, we'll see whether this trend stays the same, drops, or goes up. A key metric is hospitalization use. Hospitals are stretched. They're not overstretched. They're still able to take care of people, but they are working at pretty full capacity, and the people that are working in the hospitals are working hard, long hours, and are stressed. So this measure is very important to keep an eye on. Most of the hospitalizations over the last month have been due to cases in the Northwest, and those have principally been the unfortunate cases that have come from the Navajo Reservation. A metric that many people consider to be the most important is a metric that tries to estimate the rate of spread. This is called the effective reproduction number. or the effective R. It goes by a number of abbreviations. Some refer to it as R subscript T, some as R subscript E. The state uses the abbreviation R underscore EFF. I will just call it the RT. On average, the number of people that an infected person goes on to infect is the RT. In other words, if on average one infected person infects another 2 people, that would be an RT of 2. When the RT is 1 or greater, the epidemic continues. When the RT is less than 1, it means the epidemic subsides. That doesn't mean cases necessarily go away, but it is no longer an epidemic. The challenge with RT is that the math necessary to calculate it is extremely complicated. As a result, there are many different models for calculating the RT. For example, this model shows the RT for New Mexico, the effective reproduction number for New Mexico, as 0.95. And the blue line, the dark blue line, shows its trend. There's an orange line at 1 to orient you to the critical threshold. But look at the dotted lines. Those are confidence intervals, and what that means is that we can be 90% confident that the true value is somewhere between them. The state uses a different method for calculating the effective R, and the state estimates that the current RT is 0.87. So here we have 2 different models. I will show both of them from time to time so that you can judge for yourself which one makes the most sense to you, but bear in mind that the state does use the one on the right. The reason this matters is that the state uses the effective R as its measure of spread. When the spread rate drops along with these other measures, the state is willing to do more reopening. One important thing to remember is that cases are not evenly distributed across the state. This is a map of zip codes. Some zip codes have high prevalence, others have low prevalence. This even applies at the level of the county. Here's a section of Sandoval County, and the prevalence of cases in Rio Rancho is not the same as the prevalence of cases in the northwest portion. It's not even uniform within a city. Here's Albuquerque, and portions of Albuquerque have high prevalence and portions have low prevalence. People of all ages are contracting COVID-19. Deaths are definitely skewed toward an older population. When we look at these side by side and we want to figure out, well, what does this mean when somewhat younger people are being infected but somewhat older people are dying, we use what's called the age-specific case fatality rate or ratio. After about the age of 50, the age-specific case fatality rate pretty much doubles for each group until 90. Now, this isn't totally unexpected. After all, the older we get, the more diseases we get, the more likely we are to have difficulty dealing with new infection. Men and women are infected at the same rate, but as a proportion of deaths, men make up a somewhat higher proportion of deaths. The Department of Health doesn't publish data that allows this calculation to be made accurately, but as an estimate, for every age group, the case fatality ratio or rate for men appears to be higher. Across the world, this does seem to be playing out as the case, where men seem to have a higher risk of dying from COVID-19 than women. Maybe a little bit, maybe a lot. Across the bottom, you'll see census tracts grouped by poverty rate. So, for example, on the far left, in those census tracts, the poverty rate is less than 5%. On the far right, those are census tracts where the rate of poverty is 40% or higher. What you can see is that as poverty goes up, the rate of COVID-19 cases per 100,000 goes up. Native Americans continue to represent the highest percentage of cases, and at least as of the end of May, represented far and away the highest percentage of deaths, with 82% of COVID deaths in that week being Native American people. Having medical problems or being in a long-term care setting represent very high risks for death. Only 10% of people who were not either in a long-term care environment or did not have a pre-existing condition were in the group that died. So, what might you watch for the next couple of weeks? I'd suggest looking at the cases per day and the RT. With the easing of restrictions, we really want to watch to see whether cases per day increase and whether that RT value increases. If it doesn't, that will be very good news. One of the most important things we have done in mitigating COVID-19 is to keep the hospitals from being overrun. We want to make sure they have a capacity to care for all patients, and so watching the hospitalization rate will be an important thing to do for the next 2 weeks. This is related in part to the next bullet point, which is spillover from Arizona and Texas. If Arizona and Texas continue to have high rates of COVID-19, not only does that mean that the hospitals might become full and therefore we may have to take their patients, but people will travel from these states. No island is an island. Remdesivir is a drug that is already being used in New Mexico in an attempt to lower severity of cases. Dexamethasone has recently been shown by UK researchers to markedly reduce mortality in the very sick and those on ventilators. However, this study has not yet been put under peer review, and we'll just have to see what plays out. We still need to keep an eye on the Northwest region. The Navajo Nation is still at high risk. And then I'd suggest we watch the United States as a whole for the reasons we discussed before. Even an island isn't an island. Well, that's it for me for now. I'll see you next time.